Hello everyone! Today we are going to be discussing a question from Typical PT's platform. Let's jump right in. Alright, here's the question. A 51-year-old male presents to physical therapy following referral from his PCP for evaluation of recurring episodes of severe dizziness for the past 3 years. He describes the sensation as the room spinning violently, with episodes lasting 2 to 4 hours. These attacks occur unpredictably, approximately once every 1 to 2 months. He reports fluctuating hearing in his right ear, occasional right-sided tinnitus described as a roaring sound, and periodic feelings of fullness or pressure in the affected ear. Symptoms have progressively worsened, causing him to miss work and avoid driving. His PCP prescribed meclizine, which has provided minimal to moderate relief during episodes. Objective findings. Cranial nerve screen shows intact facial movement and sensation. Balance testing shows a positive Fukuda stepping test with rotation toward the right side, negative Dix-Hallpike maneuver, and increased sway in all conditions of the modified CT-SIB. Gait is normal between episodes, but the patient reports needing to sit or lie down during acute attacks. Vestibular screening shows a negative head thrust test and no positional triggers identified during examination. Based on the scenario provided and your clinical diagnosis, what pathology do you suspect the patient to have? A. Benign paroxysmal positional vertigo, BPPV. B. Vestibular neuritis. C. Meniere's disease. D. Vestibular migraine. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is C. Meniere's disease. Before we break down the explanation, I want to mention that the infographic shown here is from the Physical Therapy Essentials book from Typical PT. You can find this diagram and other helpful resources inside that book. Answer choice C is correct because Meniere's disease is characterized by the classic triad of episodic vertigo lasting hours, fluctuating sensory neural hearing loss, and tinnitus, all of which are present in this case. The patient also reports oral fullness in the affected ear, which is another common symptom. Looking at the diagram, Meniere's disease is described as a chronic, slowly progressive disorder affecting one ear, caused by abnormal fluid buildup in the inner ear, also known as endolymphatic hydrops. Symptoms listed in the diagram include vertigo, hearing loss, tinnitus, and oral fullness or pressure. The duration of symptoms is shown as lasting from 20 minutes to several hours, and hearing loss may be progressive. The diagram also shows that hearing involvement is common, with fluctuating hearing loss and tinnitus, which matches the patient's presentation. Now let's go through why the other choices are incorrect. Choice A, benign paroxysmal positional vertigo, is incorrect because BPPV presents with brief episodes of vertigo, typically lasting seconds, not hours, and symptoms are triggered by specific head movements or position changes. In this case, the vertigo lasts 2 to 4 hours, and the Dix-Hallpike test was negative, so this does not fit BPPV. Choice B, vestibular neuritis, is incorrect because vestibular neuritis typically presents as a single prolonged episode of vertigo lasting days to weeks without auditory symptoms. This patient has recurrent episodes over several years with hearing fluctuations and tinnitus, and the head thrust test was negative, which does not match vestibular neuritis. Choice D, vestibular migraine, is incorrect because vestibular migraine usually presents with vertigo associated with migraine features such as headache, photophobia, or phonophobia. This patient does not report migraine-related symptoms, so this diagnosis is less likely. Now that you've completed this case, take a moment to record the key points in your Typical PT digital notebook. Use it to organize what you've learned and reinforce how to apply core integumentary concepts when evaluating and managing neuromuscular-related conditions. Thanks for watching today's question of the day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.